Welcome to This Week in Missouri Politics from the state capitol in Jefferson City. We want to talk about the thing that's on everyone's mind, the COVID vaccine, and we're joined by the Missouri Director of the Department of Health, Randall Williams. Doctor, thank you for joining us.
Scott, it's great to be here. Thank you for having us.
Outstanding mask, by the way. I mean, no, didn't get better than that. Robert Knodell, the Deputy Chief of Staff to the Governor, and the point person in charge of the vaccine rollout. Thank you for making the time.
Thank you, Scott. Glad to be here.
Let's talk about how it's going right now. I mean, are you feel good about where the state is, and right now, who can get vaccinated?
We're excited about the process that the state, the progress we've been making the last few weeks. Obviously, last week was a challenge as it related to winter weather, cold temperatures in the state, as well as difficulties for people moving around on the highways, getting to work or getting to a vaccination opportunity, as well as shipping, because the winter weather across the country where the vaccine supply is shipped from factories that are around the country to vaccinators within the state of Missouri, we saw significant delays. So we did see a slowdown last week, but we've seen our vaccinators across the state really ramping up this week, making up for lost time, getting ahead, which is really exciting because we see future supply coming into the state growing and growing and growing. So it's really important that we stay caught up, that we stay ahead. And the fact that we have is really a credit to our vaccinators here in Missouri, our hospitals, our county health departments, our community health care providers, our FQHCs and pharmacies across the state. So they've done a great job. They've been resourceful, they've been aggressive, and we're happy with where we are.
The governor made an announcement this week that that more people are going to be eligible. How does that work? Who is going to be eligible, and when can they be?
On March the 15th, the governor and Dr. Williams will be activating Phase 1B Tier 3, and that will include K-12 teachers, that will include grocery store workers, and that will also include other critical infrastructure workers that will help with our state's economic recovery from COVID-19. So we're excited about that. We wanted to announce that for March the 15th because we want to give the employers, the schools time to plan, time to prepare, time to partner with a vaccinator, and we're also going to be able to take advantage of ramped up supply to be able to continue to vaccinate those that are eligible today and continue to grow and increase that rate of those that are vaccinated today, as well as adding the new population.
Dr. Williams, you get the vaccine, which I assume, have you taken it yet?
Yeah, I have, thank you.
Now, what does the vaccine do?
Yeah, thanks for the question. Clinically, the Moderna and the Pfizer vaccine offer 95% effectiveness from you getting hospitalized or sick. And we expect very similar with the J&J. There's been some studies showing a slightly reduced efficacy to that, but that is largely dependent on the study. So I just want to reiterate the message that whichever vaccine you can get first, we think is the best vaccine for you to get.
All right, I asked the governor this, I'm going to ask you. You're the head of the Missouri Department of Health. My mama back in West Butler County, she's not too keen on the vaccine. What do you tell folks like Terry Faughn and others like her that are a little apprehensive?
The first thing I would tell you is that all three vaccines have gone through a very rigorous safety examination. They go through tomorrow, the J&J will go before the FDA. That's both internal and external to government inspection. And then it goes before another committee called the Advisory Committee on Immunization Practices. They look at it. This is all after it's been vetted by the company's scientists, Johnson & Johnson. And then we will look at it after the CDC looks at it on Sunday. So my team will be looking at it this Sunday to put all that together. And if, like with the Moderna and the Pfizer, we think it's safe and effective, then we will issue an order Sunday night and start receiving vaccine next week.
So what he's saying, Mom, is take the vaccine. I think. Robert, how do you get this vaccine? What is the process by which Missouri obtains this and sends it out?
The federal government allocates to the state of Missouri, other states, territories, and tribes across the country an allocable share of the supply of vaccine that the federal government has purchased on contract from the pharmaceutical companies. And it's allocable to the percentage of population that Missouri makes up of the United States. So we receive our share of that. And
We've been getting our fair share of that so far?
We are receiving close to the allocable share. It does sort of rise and fall by fractions because of the shipping sizes that are made available. But on Tuesdays of every week, the federal government lets us know how many doses of Pfizer, of Moderna, and then if Johnson & Johnson EUA is approved of it, that we can order for the coming week. So then we work with our state vaccinators to put the orders together to make sure that we're allocating fairly across the various delivery channels.
How many do we get usually a week?
We have been getting, it has ramped up steadily to the point that I believe this week we received right at 120,000 doses. We will see that increase to just under 130,000 next week. And assurances.
How many do you actually stick in an arm? Do you have any left over, or of that 120,000, how many actually make it into somebody's arm?
We are delivering approximately 150,000 vaccines a week, and that's because of the second doses that come also because the Pfizer and the Moderna are 2-shot vaccines. So in addition to the first shots that we receive every week, we're also, our vaccinators are administering second doses. But those vaccines don't ever come to a state warehouse. We never take possession of those. We allocate them and they're shipped directly from the pharmaceutical companies to the vaccinators, whether that be a hospital, health department, FQHC, et cetera.
Now, some of our friends in the city have said maybe they're not getting their fair shake. They don't like folks, I guess, in Leopold and Palmyra getting a different supply. I'm not exactly sure what the complaint is, but I've heard some folks from the city say, we want more. We want more than our share, however. How do you split that up?
We have broken up our allocations based on the 9 highway patrol regions of the state. And so each region itself receives a share that is roughly proportional to the population of that region. And in a given week, based upon the availability of vaccinators and the shipping sizes that it comes, we try to make sure that that number stays within plus or minus 3% of that region's allocable share based on population.
Dr. Williams, I saw that Dr. Fauci was on the news, and he said, well, even if you get a shot, you still got to wear a mask maybe for a year or two. Now, there'd be a lot of folks in St. Louis that probably think, oh, yeah, we'll wear the mask, and maybe not everybody has a mask quite as glorious as yours. But after you get the shot, when can you stop wearing the mask?
Well, it's a great question. We got some very exciting news based on science from the CDC about 3 weeks ago, that if you get the shot, 2 weeks after you get your second shot with the Moderna or Pfizer, or 2 weeks probably after the J&J, if you're identified as a close contact, you do not have to quarantine. So that's how effective they are. So that's one more reason to get the vaccine, because 2 weeks after it, if somebody calls you and says, oh, Scott, I hate to tell you this, but I was right next to you in the car going to Busch Stadium and I have COVID. If you were had the vaccine for 2 weeks, you don't have to quarantine. To answer your question specifically, at this moment in time, we're still encouraging people, whether you've been vaccinated or not, to social distance, wear a mask, and use good hand sanitizer.
So when do you think there'll be a time when, let's say, hypothetically, overweight, early 40s hillbillies can get a vaccine?
Yeah, we are very excited. We think that we can look toward, both in the United States and in Missouri, probably in late April, May, open up to what in Missouri is phase 3.
And after you're slightly overweight, or maybe a little more than that, overweight hillbillies get the shot, when will the mask stuff go away?
Well, I can't, that'd probably be speculation at this point, but I do believe.
But it ain't going to be 2022, right?
No, I truly believe that by the time we get to July, every Missourian in the state who wants a vaccine will have had one. And that we believe once that happens, and we should at that point be at herd immunity, which is about 75% of the population is either had the disease or has had a vaccination, we clearly think that come August, July, that we will resume many normal activities like going to see the Cardinals
Well,
play.
that's the last question I got for you. This year, I know you advised the governor. Well, I did one other question. So when you advised the governor, at what point of, I've heard, people testing positive or getting a vaccine. Is it 75% of Missourians have a vaccine or have had the disease? That's when you would tell the governor, okay, let's go back to business as usual. What is that metric you're looking for?
I think what you're going to see is that by June or July, when everybody's had a vaccine that wants one, and you'll have that number of people who've had the disease, I think you'll see both nationally and in Missouri that many of the restrictions, if you want to say, that you're encountering now will be removed.
So, Robert Knodell, will people be able to go to the ball game in Busch Stadium just like regular Americans have the right to this year?
We are hopeful that will be the case, absolutely.
Dr. Williams, I mean, state government has a lot of functions. The most important one is to provide a healthy, safe environment for the Cardinals. Will that environment exist this year?
That's going to be up to the baseball league. They will.
If the president called you,
if the president calls me,
the main president, President DeWitt, called you,
yeah,
and said, "Should we have Scott and Gussie Faughn at the ballpark?" What would you tell him?
In July, I would say yes.
What about June?
Based on what I know now, I would say yes in July. June, I think, might be a little premature, but certainly July, based on what I know now.
And where did you get that glorious mask?
I got this here in Jeff City, and I wear it proudly.
Of course.
So give me real quickly, what's the scouting report for the Redbirds this year?
Oh, I think we got a good shot. We got enough arms, live arms. I think we're going to be good. Arenado's going to make everyone better. I mean, I think it's a great time to be a Missourian, and I think it's a great time to go watch the Cardinals in person.
Well, while Robert and I have been kind of doing this, Super Bowl, Stanley Cup, love to get a World Series in there.
Those things are nice for the people that like those kind of things, but really we're looking for a 12th World Series. I mean, that's kind of that's going to be the goal of the governor and everybody in state government. I want to thank both of you for making the time.
Thank you.
A serious project you guys have working on.
Yes, sir.
And I think everybody appreciates the effort you're putting into it. And
Thank you.
Mom, get your shot.